I call the meeting to order. First order of business is to approve the minutes of the December 2021 meeting. Any comments? So do we have any objections to them? If not, I'll just assume that we're going to approve them. Okay, we'll go ahead and consider them approved. David, do you want to go ahead and take it from here?
Hey, Mac, real quick, just one thing before we get started. I would like to just make a warm welcome to Dr. Michelli. I don't know if he's on the phone, but he is a new member to the group and had a distinguished career as a dentist here in town, and has been involved in numerous activities as it relates to public health and the town. So welcome, Dr. Michelli, and maybe just say a quick hello.
Thank you very much. It's nice to be here.
Great. Sorry, Mac.
No, it's great, Kevin. Thank you.
Okay, well, I also would like to welcome Dr. Michelli. I certainly am excited to have a person who's got the background and time spent in Darien to provide a sense of history. I think it's just great to be able to have that kind of a resource. And thank you, Doctor, for agreeing to participate in the board. And as I said, if you have any questions or comments or anything, please reach out to me at any time. I appreciate that. By way of organizational background as to our department, I put on the screen a basic organizational chart for how our department is, how it's organized, and how we function, or how we try to function anyway. And at the very top left, is the Advisory Board of Health. And over the years, this group has been really great to work with, and from my perspective, and really helpful in helping guide policies and programs that we've basically been working with. And and I sent out at the beginning of the week a communications list with emails, and of course there's a lot of names on there, and I don't think that everybody's met everybody who works for the department, and I certainly know that you, Doctor, haven't. So I thought this might be a little bit helpful for you to see where we fit and how we work together. In the middle here, is where, for me in the Advisory Board of Health. And then of course we have our medical advisor over to the right at the top is Dr. Kenefek, who's on call and has been just terrific, helping out a lot during the pandemic. And we kind of overlap quite a bit because I've been really involved and engaged with the superintendent of schools and policies with the schools related to COVID in the past 2 years. Mindy Chambrelli to the lower left below me is actually the kind of the strength and pillar of the department. She's great at all our basic support work between food service, septic work, cosmetology. She's just been fantastic. And I can't say enough about our staff. And there's a lot of part-time pieces, but they all work to make things function well, I think. So I just wanted to submit that to you for your review and for your records, so that you can see who we are, basically sort of a summary of what it is that we do. We do have some issues coming up with our contact tracers. We have 2 part-time contact tracer folks that really are going to hopefully soon not have much to do. And we're under a grant program, and we're obligated to, and we're not the only department in that position, but these folks have a responsibility under the grant terminology with the state and CDC to do certain things. So with the kind of demise of the need to do contact tracing, there's a kind of an effort underway to try to redefine a role for these folks. And I've been exploring potentially having them do some work along with the mental health impacts of COVID, whether it be kids, what it's been like for kids for 2 years to be wearing masks, going to school, what types of impacts. Also, the CDC released a report today that said 3 out of 5 overdoses that occurred in the past year may have been prevented if there were some intervention capabilities, which, I know there's a lot of counseling in town, but, what is the availability of that counseling, and what kind of assistance could we be giving to making sure that people who need help can get help? So there's a couple things we're looking at doing to expand the role for the contact tracers, as I said, who soon, hopefully, won't have anything to do. They will be able to fill in a bit because our administrative assistant, Michelle, will be going out on maternity leave in May, so she'll be out for 12 weeks. So we're going to have a kind of layered approach to have office coverage utilizing our contact tracers. They can do some COVID work. They can prepare our weekly summaries, which basically they did today if Michelle's out. And I think that we can have full office coverage during Michelle's absence, utilizing our contact tracers, in staggered time. We have a couple of interesting little projects coming up. Mindy will be doing a video as part of a PSA. It's going to be a regional kind of outreach program to show what local health departments do. And it's a cooperative venture with all the departments in Region 1, which extends from basically Greenwich to Stratford. And her role is going to be basically to show what we in local health do with respect to public health in cosmetology salons, nail salons, and the like. So kind of excited about doing that. That would be our contribution in that. I'm going to be doing a PSA basically for the Thriving Youth Task Force on marijuana and impact on kids, basically. It's sort of directed at parents to kind of warn parents about the basic differences of the marijuana today versus 10, 15, 20 years ago, and the potential dangers that poses to our kids and grandchildren. So be working on that, be doing that in the next couple of weeks. And that's a story about staff, I think, right now. Any questions there? No? All right, then, let's see. I'm going to try to pull up our weekly summary for today. I know it was sent out. Can you see that whole thing? Does that all fit in the screen?
Yeah, we can see it, David. You'll just scroll it down, right?
Yeah, I'm going to work on that next.
Okay. You may want to, can you, well, no,
There
that's
you go.
good.
Yeah.
Okay, all right, so basically the summary is we actually had a slight increase in test positivity for this past week from the last 7 weeks. We had 7 weeks straight with a decline. We had a little bit of an increase this week. Don't know what exactly to attribute that to. Maybe more testing, people traveled, it was vacation time the week before last with kids from school. Thing is, we're not seeing too many kids in recent days. So even with the removal of masking in schools so far, we're not seeing that there's been any increased transmission in schools. We're still seeing it to be largely at home. As you can see, the second line item on the highlights is case counts for those under 5 years old who are unvaccinated from February to now are lower than those in the time period from July of 2021 through January. So, we're still not seeing that age group getting sick. Here you can see our little bit of a bump up in case counts for this week versus last 2 weeks actually. So we'll be watching that closely. Obviously, we're watching it every day. So our positivity rate, as you can see, jumped from last week to this week, and you can see what happened before that. We were on a nice roll. Let's hope it goes back down this week. And you can see our age distribution. This is what I was meaning on the when I was talking at first about the younger age group. It's still a relatively low number for those that are under 5, those that are unvaccinated from February to now. So that's good news. Maybe a little bit concerned about the numbers in the more elderly age groups trending upward compared to that chart to the left where there weren't any positive cases for 90 plus between July and January, but there are now. So as you can see, we had a tremendous peak in January, and see how it plays out at the end of March. We have a ways to go yet. The positivity rate again peaked January. It's almost all Omicron for the variant.
But David, as far as the people that are testing positive, I mean, you don't sense of anyone being really sick?
We are not seeing that. So the interviews that we conduct, we're not contact tracing. We are conducting interviews. We're having more and more difficulty contacting people. People don't want to talk about it anymore, or they're not answering the phone. But those that do answer the phone are reporting relatively mild symptoms. And we also get the reports from the test labs, the testing facilities. We have 2 testing facilities in town. One's at the church, and the other, of course, is at Leroy parking lot. And we're trying to get some information from them as to the nature of people who are testing. And most people are either asymptomatic or they have mild symptoms, and they're going to check and get checked in some cases after they've gone through their at-home test kit and tested positive. So you just want to go get verified about the positive before they, I guess, stay out of work or stay out of school. But to answer your question, Mac, cases tend to be fairly mild. They may linger, but they're fairly mild. And that's consistent with what is being reported with the Omicron anyway, that it is highly transmissible, but the level of severity is not as, is not quite as bad as it was before with Delta. And of course,
Can I ask a question? Does anybody keep track of people who've had multiple cases of COVID?
no.
Because I've heard quite a few people who've had that.
You know, the data, somebody has to assemble the data and filter it. And we have trouble just getting straight data from the state, let alone, you know, trying to figure out who's multiples. We use state database for putting together our charts. And, you know, we're up over 3,000 cases. I don't know of those 3,000 cases, how many are multiples. I don't think, you know, I don't think there's a lot of them. We kind of lost a little track of that. We could tell you before that huge spike occurred in December and January. We could tell you before that huge spike. But in that particular period of time, there were so many cases. If you know, you look back to that peak that we had, we absolutely could not keep up with doing interviews during those 2 months. You could see that. I mean, we were able to manage interviews and keep track of folks right up until December. And I guess at the second week of December, it just became unmanageable at that point. And to that point, we really didn't have multiple cases. But there, I think, are with the Omicron, there were multiple cases. That was one of those situations where, yes, you're right, there were multiples, but I don't know how many, and I don't know how we would be able to pull that out from the state database.
I just wonder if it's significant.
I know, it's a good question.
I don't know.
We can look into that further. Deb, do you know if that's something that can be pulled out?
There might be a way to search it through that contact program, but it depends on what information gets put in. If the contact tracer is adding in that field. So, I mean, it would take a lot more. Yeah.
Okay. All right. Thank you. So, and you know, our vaccination rates are really high, but what's been shown is that Omicron doesn't really care. And you know, the message is that your possibility of becoming severely ill is again reduced significantly if you've been fully vaccinated and boosted. And I think that, you know, one of the things, as I said before earlier, was that, you know, with our 65 plus, we're seeing cases that are increasing in number there. So I would like to encourage that age group that if they haven't gotten their additional dose, that they do that. And you can see that on this chart, that's, you know, only 74%, which is still a good number, but 74% have gotten the additional dose. But seeing that there's an increasing number and the potential risk that those folks face if they do get sick would seem to warrant getting that booster. And under any circumstances, if you look at the percentages, we're doing far better than the state. We're above the average levels of the state. But by and large, Connecticut has done very well. And you know, when you look at a fully vaccinated among eligibility, fully vaccinated at 75, 76%. That's a huge success story right there, statewide. And at this point, we have 2 test locations in town. We have one at the church, St. John's Church on Post Road. That's a state-sponsored facility. It's free. You do have to provide your insurance card. And then, of course, we have our longstanding drive-through test site at the Leroy West parking lot, both of which are reporting significant declines in volume and testing. And in fact, I got an email today from the clinic at the church requesting permission to cut back their hours to 9 to 1 daily instead of current 9 to 5. They're doing 9 to 5, 5 days a week, and last week they did 87 tests over 5 days. So there's a lot of downtime with those long hours. So I'm basically supporting their request to cut back on their hours. It's just too much time with nothing to do. We are done at this point with our clinics. We really haven't had much of a demand for vaccine. And after 60 clinics, well, actually our first clinic was January 20th last year. And we've done 60 or so clinics and administered over 9,000 doses of vaccine in that period of time. Before I showed you what our staff is, so obviously to accomplish that, we had a lot of assistance from a lot of volunteers from the community, both vaccinators and also those who helped us do processing of people coming through the clinics. It was a tremendous kind of heartwarming tale of community success and community cooperation. Town should be proud of itself for the way they turned out and worked together to respond to the pandemic. Are there any questions about this week's report? Well, like I said, we're on a good trend, and we all hope it continues. The other program that we've been working on recently is January. January's over now. January is Radon Awareness Month, and we, for the past 5 or 6 years, have partnered with the State Department of Health in providing free radon test kits to residents. And in past years, we've gotten maybe 25 or 50 test kits. This year we got 50 test kits and they were gone like in a week. So we tried to get more, and we did. We ended up getting, I think we had a total of 75 kits, all of which we've distributed to residents. Out of that last count, we have the data from almost just under 50, which is, again, I think it's a pretty good return for that. We do follow-ups. We contact people when they've gotten their test kit to remind them that if they haven't done the test, to please do it and send it in. But the good news is that out of the 50 or so that we do have the results for, we only had one that exceeded the recommended limit of 4 picocuries per liter, and it wasn't that much of an exceedance. And that's consistent with our past testing results that we've seen in town over the past years. We really don't seem to have a hotbed or area localized area that seems to be, problematic. Some communities in Connecticut do, which is why the state offers this program. So as part of what we do is, of course, when there's a positive that's high, they're given some advice by the testing company, and we also follow up to provide some guidance and advice to folks that may have elevated radon levels. But yeah, I'm pretty happy with the way that program, first of all, with the response to the community this year. Maybe it's because we're spending so much more time at home. So people are more aware and more concerned about, getting their homes tested for radon. But this is the most test kits we've ever given out. And I think it's also probably about the highest return rate for getting the testing actually done. Questions or comments on the radon? Okay. Well, we're quickly moving into the time of year, believe it or not, when we're going to be starting to talk about our beach program, water testing that we do every week, and permitting and inspecting our pools. That's going to come up, and we're going to try to get the pool permit program done early this year because we would like to get that done before Michelle leaves. And also the same with our seasonal food service operations, the snack bars, at the golf courses and country clubs and at the beaches and so on, permitted and inspected prior to the middle of May, which is when Michelle is due. So we're looking forward to that. We're not looking forward to mosquito season. See what that brings this year. West Nile and sorted other risks and threats to us. And I think that's about it for my report. Oh, we are doing I don't know if I mentioned earlier that we're going to have a high school student come in and intern with us for her senior, part of her senior project. And this young lady is founder of the Cancer Awareness club at the school. So we thought that we would put her to work on doing some health assessment for our most recent chronic and cause of death illnesses, including cancers in town. I think that would fit right into what her level of interest is. She would like to go into public health in school, and she goes on for her education. So I'm kind of excited about utilizing that as part of our updating for our status health needs assessment for town. So with that, hello, Christine. With that, I really don't have anything further to add, and I'm open to questions.
Sure. Just any feeling on how the overall flu season went?
Yeah, we gave pretty much the same amount of seasonal flu vaccine this year as we did last year, about 250 doses. We had planned for about 300. So we were a little under. We did it the same way this year as we did last, by having it be by appointment rather than open clinics. With all this, we don't want to have clusters of people gathering at any one given time. So we did it by appointment. We have the online scheduler. That works quite well. We'll see what happens next year. We'll order our 300 doses again, and we'll see how that works. And hopefully next year we can just have a regular, old-fashioned, clinic scheduled without an appointment. But you know, that even with what we did the last 2 years, that's not that different than what we've been seeing even when we used to run the open clinics. You know, we're really a kind of a stopgap place for folks to get vaccine, because you can go to CVS just any time really and get vaccinated, or you know, at Greaves, you know, they offer the vaccine. It's so convenient. But you know, we think that we'll certainly continue offering it again until there's no demand. But you know, as long as there's demand, we'll do it. It didn't seem as though there was you know, in looking at numbers of flu cases this year, the number of confirmed flu cases really wasn't that substantial. Again, last year there was none. This year there was some, but it still wasn't. It wasn't as bad as it had been in years past. People are still being pretty careful, you know, with distancing and masking. Makes a difference. Those things do make a difference. Questions, comments, ideas, things that we should do that we're not doing, what we shouldn't do.
It's a quiet crowd here.
Yeah, well, you know, we're from a statewide perspective, we're kind of looking at a couple of issues that are significant, and it has to do in one part with adequate funding for local health departments, because as you know, since Darien doesn't have a population of 50,000 or greater, we do not get any state per capita funding. So the way the law is written in the state is, you know, you have to have a certain number of people to get state grants, a state grant. There's an effort this year to level the playing field and provide testimony and try to get that changed so that all jurisdictions get state funding. That would seem to be a form of equity. Public health is public health. It's for everyone and should be funded equally. Sure, there's programs that can be directed for targeted issues and targeted problems. Lead is another one of those big ticket items, that lead poisoning. I mean, you know, and it's a big problem in a lot of locations and very expensive, has an expensive price tag to remedy, but the cost is high, you know, in terms of the damage that it can inflict on children and developing brains. So we have that to contend with. And of course, as I said before earlier, we do have the legalization of marijuana that we have to work very closely with and try to manage some kind of public outreach and educational programs associated with that. My concern is really about the fact of edibles and how, you know, widely used that can become, and you know, the problem that it could represent, and overdose potential from edibles. So we'll be working on that and looking at that over the next several months.
David, so talking about marijuana and edibles, what has been done now, or do we have a problem with the vaping in town? I know they had that lecture a couple of years ago at the library, and everybody was concerned about vaping, and you know, parents and being informed about the dangers. Do we have a problem with that at all? Do you know, in Darien?
Well, I'm sure we do, you know, and, you know, as far as how to measure that, Again, the Thriving Youth Task Force had done a survey of high school kids, and the numbers seem to indicate that it's not a problem. But those are self-reported surveys, and I don't know, I don't mean to question the accuracy of or honesty of people filling out self-reported surveys, but the data would seem to indicate that vaping is widespread. And I don't have any way of knowing really what's happening in the high schools except for talking with the officers that are at the high schools and the administration there.
But we haven't had reports from the hospital or anything that you know of where people have become very ill or, have lung dysfunction or something from the vaping.
No.
Okay, well, that's good.
But that's part of. We're working with our the Post 53 and their monthly. They provide us with monthly reports, and we're working with them to try to get some assessment as to how many positive situations and problems or calls they have that are substance use related. So, so that is something that we're looking into and trying to correlate with our with Post 53. And they have been providing it. It's been getting a little bit better, but that's something that we're going to work on further. How many motor vehicle accidents are the result of substance use? And I'm kind of getting off your question a little bit by vaping, but how many calls are related to substance use, whether it's falls, because they're still our number one reason for emergency response. Is it drinking? Is it drugs? So yeah, these are things that we're going to be looking at. And these are things that I was hoping to be able to use some of those grant funds, ELC funds for, that we're using our contact tracers on. But we'll have to see.
The other thing too is with that extended period of lockdown for the kids and college students, and reading so much how suicide rates have been going up among the high school and college age students, even younger sometimes. And I was wondering, as we have had an increase in Darien with attempted or suicidal ideation, do you know any of that? Has that come through at all?
Doesn't come through our office. Again, that's something that we have to coordinate more fully with Post 53, because they're the ones that get the calls. And if they don't report it to us, we don't know. There's no mechanism from the hospital or obligation on the hospital's part to report to us either. That's been one of the issues that we've had all along, with even the lack of required reporting for drug overdoses. There's no requirement for hospitals to report to local health departments about whenever there's an overdose. So we're trying to work that out with our responders.
Yeah, it's interesting because they should be giving some kind of feedback. I think, some so that we can have more prevention programs if that's necessary, or
Exactly.
you have some kind of early intervention.
Exactly. Yep.
Thank you.
You're welcome.
David, I think the board also really wants to know about you. Are you going to get any vacation time coming up?
Well, Kevin and I have a birthday.
Well deserved.
So I think we're going to, not together, but I think we'll be taking at least a day off. But I have a couple of little getaways scheduled. The problem today is, as you know, if I take my cell phone with me, I'm still in touch, and it's not like you're getting away. There's no such thing as the old-fashioned vacation where, you're out of sight, out of mind. It doesn't really exist anymore. So it's going to take some doing to actually figure out a way to get away from it all and actually, I don't know, go out, go underwater, maybe, you know.
Well,
But yeah, I have a
Don't say
couple.
that. You take the ferry every day.
Yeah, I know, and even on the ferry, you know, there's service all the way across, so you can't even get away that way. Have to go further out to sea, I guess. But yeah, thanks for asking, Mac. I'll
Sure.
consider it.
When's our next meeting?
June.
June, okay. Hopefully you can report back then.
Yeah. Yeah. All right, folks.
Yeah.
There's no other questions. I don't think I have anything further to add. Check my notes. No.
Well, I think without objection, let's adjourn the meeting.
Thanks for pinch hitting, Mac.
Okay, thanks, Kevin.
All right, everyone. Thank you, and good night.
Okay, thanks, David. Thanks for all you do.
Thanks, David.
Thank you. Bye now.
Bye now.